Welcome to the Plastic Surgery Case Files, where we show you what goes on behind the scenes even before your surgeon scrubs in.
All right, Kristi, so this is a 40-ish woman,
Okay.
2 children, wants breast implants, but was told by a plastic surgeon that in addition to her implants, she needed a lollipop lift.
Okay.
And she did not like that answer because the scars, to her were unacceptable. So how do you know when a patient actually needs a lift or not?
Right, yeah. Obviously, this patient is beautiful to begin with. It's nice when you have a great canvas. We always talk about breasts being sisters, not twins, so asymmetry is super common. But the question in her is, what size does she want her breast to be? I think because that comes into that biodimensional planning. I don't have any laterals on her, but certainly she's got some moderate ptosis, one side more than the other, of course, her larger breast. But the other question is how much vertical stretch is there? Because I think that comes into play too. It's not necessarily the cranial to caudal or up to down, but the pull, the tissue stretch. Don't have that there, but that sometimes pushes me over the edge of whether or not I need to add some skin tightening procedure. And I'm a classic minimalist. If I can save you a scar on your breast, if I think you're a tweener, I'm gonna do an aggressive, dual plane, really see if I can make that internal tissue work for you. And we can always, run that gamut that maybe I need to add a scar later, but let's see what happens if I think I can get away with it.
I really like your answer. There was a lot of wisdom in there for a younger plastic surgeon. But I think that, to determine whether or not a patient needs a lift, you need to look at 2 things. One is the position of the nipple.
Sure.
And 2 is, as you said, the skin stretch, where you just pull on the nipple from the side view and see how much it moves.
Right.
My rule of thumb is that if the nipple needs to come up less than or equal to 2 centimeters and your skin stretch is 2 centimeters or less, then you don't need a lift.
Right, this whole concept of bidimensional planning.
You don't need skin tightening. Right. The implant itself will fill up the skin envelope. It will lift the nipple, at least create the impression of lifting the nipple. And I think a biplanar approach is very useful in that it puts the implant a little bit lower, so it lengthens the lower pole a little bit, and it doesn't, if the implant's too high, obviously the nipple looks lower.
Right.
So,
how do you discuss, differential implants in these patients too? I mean, there's 2 schools of thought on this. Don't make their asymmetry become your asymmetry. So do you add fat maybe to the other breast, or do you do differential breast implants, either in width, profile? How do you approach something like this? Because I think that's a good conversation too.
Well, I think this photograph is a little bit, she may be off center a little bit. I don't think she has a parenchymal asymmetry, so I wouldn't consider this an asymmetry case.
Okay.
That's another case we're going to present. But to answer that question, my personal opinion is you should try to keep the implants the same size.
I'm a big fan of that, and do something
and make the modification in the tissue, because over time you want the breast to have the same composition, same amount of tissue and the same amount of implants, so that they settle in age at the same rate.
I'm absolutely agree with you in that instance too. I think a lot of people in town or in the country do something different. They may do differential implants in this patient, even if it's 30, 50 cc's of difference. Saline, of course, you can control that variable differently than silicone. I think a lot of us, if it was silicone, and I don't know what you chose, she looks phenomenal regardless. But you have a little more play with saline, so maybe that would be where you make up for that. But silicone, I depending on her degree of asymmetry, might not have been different. Excellent. And then abdomen, did you do anything to her abdomen?
Yeah, she just had a mini semi-tuck,
Okay, gotcha.
But the main issue is the lack of a breast lift. Mm-hmm. And this was actually a very simple case, an inframammary incision, a biplanar 2.
Okay, great.
Biplanar 2 silicone augment.
Great. What size implants do you remember, rough estimate?
350.
Okay. And do you like moderates, high in this patient, or do you let them?
It depends. She was a moderate plus. Okay. Because I like, for moderate plus, if you use a high profile and you're putting the implant a little bit lower, sometimes you get a little hollow up here.
Sure. I would agree, because it's pushing against your tissues in a different way.
Yeah.
Well, beautiful case. Yeah,
thanks.
Absolutely.
For more peeks behind the scenes of other plastic surgery cases, keep coming back to theplasticsurgerychannel.com.